All right, all right, all right. So, moving on to healthcare for all. One of the things that I really like a lot, and look, Eric, if you swing the other way, this will be a way to get my drawers down. You said implement a United States national healthcare system. Okay, that was uncomfortable. But still, the sentiment is true. This is after my own heart because I kept saying to many people, single payer healthcare is now not good enough for me. I'm like, you know what? No, no, no. We're going farther. We're going to nationalize it
Going all the way, baby.
All the way, baby. We're nationalizing the hospitals, the medical device companies. We're nationalizing pharma. We're nationalizing gyms. We're nationalizing. Oh my goodness, I'm forgetting the name. Rehab facilities. All of it. Every single thing having to do with health, including holistic health. I don't care. The thing is that because if it's done for profit, that means somebody is going to suffer. Even with a single payer system, guess who still gets shafted? It's going to be the people collectively because these hospitals are going to raise their rates so fucking high that our taxes will eventually go up too. So, no, they are not going to do it. We're going to do it in a way where it is actually cost effective and not done for profit at all. So, yeah, and people are going to look at me like I'm crazy, especially a lot of people who are more prone to capitalism.
What's next, JB? Are you going to want free fire department? You're crazy.
Yeah,
that's crazy talk.
That's a good point. I mean, the
free
fire department
shirtless firefighters.
Free public school
free
next?
shirtless firefighters. Oh boy,
free shirtless firefighters for all, baby. and I'm not. Wait. And for the straight guys, I'm not discriminating.
Oh, there you go.
Never mind. Look. I only kid because I try to have fun. But no, you're absolutely correct on this. It's like, yeah, free firefighters. Like, why is this something that is out of beyond the pale for people, right?
And one thing too is I mean, first of all, I know I'm not telling the audience anything they don't agree with, but healthcare for profit is just pure evil. One of the things that I think about is on this topic of protect the right to bodily autonomy and reproductive choice. What happens is healthcare insurance actively makes clinical decisions for the patients.
Yes.
A lot of doctors are as frustrated with the system as possible because they will say, all right, I am the doctor. This is my patient. I am prescribing them this. And the insurance company will say, oh, that doesn't fit in with our guidelines. You literally are having a health insurance company make medical decisions for you, taking it out of the hands of your doctor. Mm-hmm. And that is a major problem.
Yeah. You know how the Republicans especially kept talking about death panels? They literally exist. And they literally work for the healthcare insurance companies. They make choices based on what information your doctor gives them. So let's say, for instance, your doctor saying, look, this procedure needs to be done. This procedure might be experimental, but this is the best chance for you. But they can't do it if the insurance company says, you know what, no, we're not going to pay for that. So then the insurance company just sentences you to death or sentence you to a life that is devoid of quality because they don't want to shell out the money because they actually get money by denying you care. So with that being said, they do not deserve to exist at all because they're literally a barrier from you having good health. And so this is one of the reasons why I also am down for all this, so.
And so any strategy, any list of demands or any plan is going to have to deal with this in some fashion. And if a left strategy is to let it all burn down or say that, the government, it's falling apart and there's nothing we can do about it, the problem with that, if that's where you're landing, is there's a whole lot of people and I'd include myself who depend on pharmaceutical products, depend on the medical system to literally survive. And if that goes down, if we're into some post whatever Mad Max world, there's a whole bunch of people that are just going to be gone in a few months. And so, we need to have a plan, have a proposed solution and strategy that doesn't do that.
Of course.
We have to fix this thing.
Right.
There's really no other choice, or there's millions of people who are just dead.
Right.
And that doesn't make for a good movement if that's your plan.
Yep.
Well, I just don't want people to think that that's the plan of a lot of us. If it has to go that far, is of course there has to be contingency set in place to safeguard as many people as possible. The thing is that the oligarchs will hold us hostage wherever possible.
So
See what I mean?
we need the numbers.
So
It's
yes,
our only chance.
yeah. So I just want to say that that's not I don't want to construe that that's what a lot of us who are more revolutionary minded on the left. That's not what we're saying. And that's not our goal, our aim, or what is being proposed. So I just wanted to put that out there as well.
Mm-hmm.
Of course, they cover all aspects of healthcare, dental, vision, preventative, etc., including hospice care. I think hospice care also should be included in that as well.
So that's a good one to add.
Another thing is this is in general that I in general I support all education should be publicly funded and available to people, but especially when you come to healthcare and to the law, I think a big problem is that you need to be privileged for the most part in this country to become a doctor, a lawyer, even a nurse. So what you have here is you have a certain group of people that are involved in these decision-making processes. If you can open up access for education, you're going to have a more diverse set of practitioners and more ideas coming in here. And I generally believe that more diversity will lead to more, revolutionary progressive ideas.
Yeah. And that is also a really good point, because a lot of the people who are involved in going into law or the medical field tend to be, I'm not saying all, but tend to be people of a privileged class. And then even on top of that, some of them have to go into extreme amounts of debt, student debt, in order to get to where they are. And call me crazy, but I'm of the opinion, all right, I'm gonna let it hang out. I'm of the opinion, not just tuition-free college and university, but tuition-free medical school, postgraduate, and law school. People look at me like I'm crazy for that, but to be honest with you, I think education is a right. And if you want to go to school to be a lawyer and attorney, I don't think you should have to suffer to do that. Or I think if you want to go and get all that education, but you still want to work with your hands as a carpenter, but you have all this knowledge of the law, okay, why is it gatekept? The law should not be gatekept.
Yeah.
Gatekept. Sorry.
Yeah, and it's even that gatekeeping within a law, it's a relatively new thing, and I wonder even if the idea of law school was put in there to create the legal profession as being more inaccessible to certain groups of people, because historically that was not the case. Historically, becoming a lawyer was an apprenticeship. You would apprentice under a lawyer, and after a certain period of time, you would take whatever exam, and then you would be a lawyer. There was no law school. I think law school really became a thing more in like the 40s or the 50s.
Well, yeah, there was a black man that was talked about. He said you have to blame me for the bar exam because I wanted to become a lawyer, and they didn't want me as a black. He was saying because they don't want me as a black man to become a lawyer, then they created the bar exam. So now you have to pass the bar in order to become a lawyer. So really, there was racist implications in creating the bar exam for lawyers. This is why critical race theory is also very important, kids.
Yeah,
So,
definitely.
so
There's
yeah,
a big history of that. Straight up
yeah,
from the voter tests after Emancipation Proclamation, straight
yeah,
up to gun control laws didn't exist
yeah,
until the Black Panthers peacefully protested with firearms outside of the California State Assembly.
yeah.
That was when gun laws came in. So yeah, I mean, there's a huge history of that, obviously.
Definitely, definitely.